morning. My name is Almas. Today I'm talking about diabetes in the United States. First, let's start the 2019 report from the CDC shows 30.3 million adult population in the United States have diabetes. Out of this number, 23.1 million people have been diagnosed and 7.2 million is undiagnosed. According to the CDC or American Diabetes Association, diabetes remains the seventh leading cause of death in the United States. Nearly 9.4 population affected by the disease, and mostly it's affecting African American and American Mexican. The number is from the CDC. American Mexican is 20%, African American is 18%, and white is 12%. People mistakenly confused type 1 and type 2 diabetes. Type 1 diabetes appears when you are small, when you are a baby. Type 2 diabetes appear in the middle age and in older age. They both are different one from the other. I have personal experience about this disease because the disease has also affecting my family. My dad, he passed away a few years ago because of the diabetes complication. He has eye problem, he has skin problem, he has neuro problem, and he died a few years back because of the complication. And second, I have a little background nursing, and it's part of the education, and I have little knowledge about type 2 diabetes. What is type 2 diabetes? It is a disease where the body is not using insulin properly, or when the body is unable to produce enough insulin. Okay, let's see what's the cause of diabetes. Genetic is a big role. As we mentioned, Hispanic or African American is the most affected ethnic group, and lifestyle choice. Poor nutrition plays the major role in type 2 diabetes. If you eat like high in fat and low in fiber, it appears diabetes type 2. Lack of exercise and overweight, those one is the cause. Diabetes type 2 prevention and medication. If a person has a gene responsible for type 2 diabetes, it doesn't mean that there is 100% chance of developing a disease, but the chance is a little higher than the normal people. The disease can manage through lifestyle change, feeding habit changing, exercise like 5 days a week, 30 minutes, and eat small portion, drink lots of water, and exercise, maintain the body weight. Those ones helps a lot. Taking insulin and other medication, oral medication, doesn't cure the disease, but it's just maintaining the disease. In conclusion, diabetes is the seventh leading cause of death in the United States. African American and Hispanic are the two most affected ethnic group in the United States. Lifestyle change and feeding habits have huge effect in reducing the disease. This one, the citation I found reference is Centers for Disease Control and Prevention. This is 2017, and diabetes system.org and diabetes statistic. Thank you very much. If you have any question, you can ask me.